Meanwhile, let's bring in Kellyanne Conway, longtime counselor to the president, helped him get reelected in 2016. Imagine at some point help him keep that job through 2024. Kellyanne, welcome back. As you see, I see the president's out visiting Honeywell plant. He's going to be out and about a little bit more. But I'm really struck by that report that came out that New York Times got a hold of, put out by FEMA, that says with 1,750 people lose their lives to the COVID-19, that's going to go up to 3,000 by June 1st, a 70% increase. Are those the numbers that you've heard circulate around the White House too?
Well, the White House yesterday clearly said, Brian, that, and good morning, that the task force did not generate that document, and no one at the task force, to my knowledge, has been asked to review it and scrub the data and agree with it. I think the most important thing to note is that the president has said all along that we are going to have death and destruction. What we've been trying to do here is to mourn the dead and grieve with those who have lost loved ones, and then to try to mitigate the damage from this invisible enemy. That's why this president has done things only a president can do. Joining forces with companies like Honeywell to develop high-quality N95 masks, respirators, deploying these ventilators to every state. Everybody who needed a ventilator got a ventilator, working with Democratic governors who are accrediting him and lauding our efforts to collaborate with them, not compete with them, dealing with the other G7 leaders, because this is a global pandemic, repatriating 62,000 Americans who were abroad when the pandemic started to really metastasize. All these things that only a president can do, signing into law 3 consecutive packages, over $3 trillion in direct relief. And the president is going to continue to do that. We know that additional deaths, sadly, will continue. What we're trying to do is show that this healthcare president is the one that is governing and directing his FDA to approve pharmaceuticals and devices in record time. Sometimes it would take 4 to 6 years. It was done in 4 to 6 weeks. Same thing at HHS and CMS. These hospital rules and regulations have been relaxed. This president, $100 billion now plus for the hospitals for reimbursement. That's a significant amount of money, because about a third of that is going to cover COVID expenses for the uninsured. This healthcare president started out with transparency, surprise medical billing, kidney health, decreasing your Medicare premiums, but now the National Guard's in there sanitizing nursing homes. Now the VA said last week it's tested all the people in its veterans nursing homes. We're going to continue to bring testing online, and that's what we're focused on, that the healthcare president continue to deliver for America at this time of the pandemic crisis and other healthcare needs.
Kellyanne, tell us why he decided to go to Honeywell. He's flying over to Arizona today. Why?
Well, Honeywell has been one of many private sector partners who really stepped in and stepped up on behalf of this country, Ainsley. In this case, Honeywell committed to and, in fact, delivered on its commitment to produce high-quality N95 masks, respirators. We have smaller companies like American Leather, a company that converted its factories in North Carolina and Texas to try to help make gowns and masks as well. We have success stories like that all across the country. You've seen everyday Americans check on the elders in their lives, their neighbors, donate to the food banks, to the blood banks. People really coming together. And it turns out that Americans can be part of the solution for something as serious as this global pandemic. We followed instructions. We slowed the spread for 45 days. And now, as we gradually and safely reopen in about 35 or so of the states, Democrat and Republican governor states, we'll keep an eye on that. We put out almost 3 weeks ago, Ainsley, Steve, and Brian, our 3-phased approach to safe gradual reopening. And so the states have that. Our health team and our economic experts have told everybody, present your plans to us, share them with us, and we'll help you, we'll help you see if they comport with the guidelines and how best to support your efforts.
But one of the guidelines, Kellyanne, was if you want to enter phase 1, you've got to have 2 weeks where you've got negative growth of the virus. And, you look at the states that are reopening, it doesn't seem like that is the case.
So I think some states are reopening in some areas. And let's take Florida, for example. Governor DeSantis of Florida was here last week. He has 3 very hard-hit counties, as I understand. They are hundreds and hundreds and hundreds of miles away from some of the beaches that reopen in the northern part of the state. I think you'll see examples like that across the country. Also, it depends on the industry and it depends on the individuals. If you are a 72-year-old worker who had exposure or has underlying conditions, you may not go back to work perhaps as quickly as, say, somebody 30 years younger, 40 years younger than you, non-exposure, living alone, healthy, asymptomatic. So that's one example. The other example is just to show that we as the federal government support what the states are deciding so long as they are comporting with that. Let me just make clear, too, some states flattened a long time ago. Some states, as Dr. Birx has told us, never really had, thank God, a big surge. So they've been flat all along. It would be hard for them to decrease their numbers when they've been pretty flat for a while. But if you don't see that surge, and then that's why our medical team also says the sentinel surveillance is so important, because we'll be able to tell people, hey, there was a big outbreak in your state a few hundred miles from you, but it was a wedding or it was a nursing home or it was a prison. We're keeping our eye on that, but it may not affect you as much as if it were in your neighborhood.
So I understand the House made it clear last week they would like to see Anthony Fauci. The White House said, no, you're not going to do that. But the word is the president will let him go in front of a Senate committee. What could you tell us about any member of the task force and testifying sometime in May? And can you separate the chambers? You have a different policy per chamber.
Our lawyers are probably sorting that out. I prefer that our health and all of us, our experts, really focus and continue to focus on this pandemic, which we've been doing for 2 straight months at the White House, rather than.
But they say they are by getting the latest from the task force.
Sure, well, that's okay. And listen, if the president has no problem with that, there's no executive privilege attached to that based on the task force conversations, then I'll leave that to the lawyers and to the different testifiers. I think it would shed a great deal of light. I just hope that the people who are asking the questions are asking intelligent, rational questions that are actually relevant to the American health, because we've seen what they do before. For example, they say stupid things like, this is a job interview. This is a job interview for a lifetime appointment about Brett Kavanaugh. Let's believe all women, or at least those 3 women, most of who then retracted or didn't have corroborating evidence. So let's make sure that they don't, that they make good use of the question time of Dr. Fauci and other members of this task force, and they're not doing the usual fishing expedition, because we had 2 years of collusion nonsense. Then we tried to impeach a president, remove him from office.
Kellyanne,
None of that worked.
Just to be clear,
it better be about health.
Right. I'm pretty clear. The president said no, or the White House said no to Anthony Fauci to the House, and I thought said yes to the Senate. Yesterday, that seemed a little bit cloudy. Senator Schumer indicated he will be coming to the Senate. Do you know if that's true? He will be going to the Senate and not be going to the House?
No, I'm not going to say that today one way or the other. I'm saying it's up to the president and the lawyers here. If they were to say yes to that, and I didn't say they said yes to that, then I certainly hope people would make good time. They would spend the time in relevant fashion on behalf of American health, so that you have the infectious disease lead for this country and for the task force there talking about the task force work, and saying that the mitigation tactics we all undertook have actually helped to slow the spread. I've heard Dr. Fauci say that publicly and privately. Look, Dr. Fauci, I think he has a media engagement at least daily, so he's got great exposure to the country in terms of helping them to understand this pandemic and what to do to protect themselves and others. Sometimes those questions are relevant and sometimes they're not. It's just a couple of weeks ago you had a reporter from a different network basically shouting him very abusively, accusing him of being a supplicant and not being able to think on his own. Are you here on your own free will? How insulting to one of our 2 or 3 infectious disease doctors on the task force, working day and night to help all of us. So let's just make sure that if he does, if he can, but I think that our work is very clear every day too from the task force. You've had these task force briefings. We've made our doctors, our economists, the president, vice president themselves, cabinet members available to the press, available to the people, quite remarkably, and if not historically and transparently.
All right, Kellyanne, let's talk about Michael Flynn, because so many things have just broken this week. We're learning now the FBI had Priestat possibly in that room at the White House, and Pienka. What do you know about him? This guy that I think worked for the FBI and also participated in the Russia collusion and surveilling Carter Page's phones. And this is Jim Jordan, because Jim Jordan wants some answers, and he's asking for Christopher Wray to speak about this. Listen.
Where's Chris Wray been? He's been FBI director for 2.5 years. We want the documents. We want that 302 that was changed. And we want to talk to the agents who were there when they interviewed Mike Flynn and why they changed that 302. So give us the documents. Let us talk to Mr. Pienka, the guy who was in the room with Peter Strzok when they interviewed Mike Flynn. That's what we want to see.
Kellyanne, enlighten us. Tell us about who was in that room at the White House when the FBI interviewed Michael Flynn when he didn't have an attorney there. And by the way, his attorney is now retweeting a tweet about Christopher Wray. She wants him fired.
I think sunlight is the best disinfectant, and that we should have it all out there in terms of the transparency and accountability here. It's obvious the president is absolutely correct. Michael Flynn was castigated, denigrated, and as he told the New York Post in an interview yesterday, probably treated more unfairly than anybody else. And he's right. And ladies and gentlemen, the FBI, the Obama people, frankly, sent their folks, the Obama-Biden people sent their folks here to the White House a few days into our administration. Did they come here to help? Did they come here to warn us that Michael Flynn is a Russian asset or no? And he had been their colleague. President Barack Obama told President-elect Trump, you have two things to worry about, North Korea and Michael Flynn. That's just odd stuff. Those are the two, the nuclear-capable North Korea and Michael Flynn, a general who had served for 3+ decades with distinction, and for the Obama administration, which continued to give him their top security clearance. So we will find out who was in that room and why they were setting up. We've already seen the notes in the margin. Should we get him to lie or be fired? We already know that the fix was in. And I think that we are going, and if people say, oh, you know, you're just trying to investigate. Folks, we went through a 2-year investigation on your taxpayer dollar, and we complied with that in this White House. Nothing came of it. The Mueller investigation, the Mueller report, the Mueller testimony, remember those? And then into the Ukraine investigation, we have every need to know transparently what happened. And I do think Director Wray should speak also. I think the current FBI director should speak. I think the former FBI director who got a hero's welcome, red carpet, kill the fatted calf treatment, Jim Comey, his book, these primetime interviews, he lied too. He's a liar and a leaker. He lied under oath in Congress. He lied and leaked. His book is a roll of paper towels at this point. So I want to hear also the people at the top echelon, the FBI, who tried to prevent Donald Trump from being elected, were political in their jobs on taxpayer dollar. They continued to do that after he got elected during transition and in the early days of our administration through Michael Flynn, the newly installed National Security Director. We need to know.
Right. Kellyanne, before you go, breaking news, down in Venezuela, Nicolas Maduro says his government captured 2 Americans. We believe they could have been special forces. He refers to them as mercenaries, and he says they were in his country to try to kill him. What's the White House story on that right now?
I'll let the national security folks, if not the president, talk about that. He'll be leaving here shortly and maybe take questions on the lawn from the press. But let me just repeat, we don't believe Maduro is a legitimate president, and he's a thug, as the president and the Secretary of State and others have said. And also, I just want to say, when the president visits Arizona today, he's doing one other thing in addition to Honeywell that's very significant. He's having a roundtable with Native Americans. He will be signing a new proclamation for missing and murdered Indigenous women. We had a big event here in the Oval Office the end of November. We also have invested over $8 billion in the tribal lands due to COVID-19, a major investment because they and other vulnerable populations have been disproportionately hard hit, and we want to make sure the president is there to speak with them directly and see that that commitment is being made for them. We'll keep you posted on the Venezuela situation as it unfolds.
Okay.
All right, Kellyanne Conway, thanks so much. It's going to be a busy day.
Thanks, Kellyanne.
Meanwhile,